Hey guys, Dr. Ray Marque here with your latest edition of Dr. Ray TV. Today is Today is Tuesday. It's around 3 o'clock. I hope everyone is doing well. It's beautiful out there. I'm coming to you from our Murrells Inlet office at Back Pain Relief Center. Today our topic is going to be what to do if you've been in a car accident or a personal injury case. And, you know, number one, my job, or all the doctor's job, is to get you better, first and foremost, and do everything we need to do to get you better. If you've chosen to go the route of using an attorney, and we're going to try to get compensated from some personal injury things, there's certain steps you want to do, and I'm going to guide you along those ways. And I want to first start this off by saying, hey, you know what? I'm not an attorney. This is by no means any kind of legal advice, but I've been doing these cases for a long, long time, and I know all the things that we need to do to work your case up to make it very presentable and workable for your attorney. And I say that because insurance companies are not on your side. They will fight you tooth and nail, and they will nickel and dime you for everything. And the better documented your case is, the easier a job your attorney has, and the more likely that you get compensated for your pain and suffering. And remember, pain and suffering isn't just your physical pain, but it's a pain in the butt of getting your car fixed, taking time out of your day, having to go to the doctors, do therapy 3 times a week for a month or 2. It's all things that you wouldn't be doing if someone else wasn't negligent and hit you. So your time is worth money, and let's make sure that you get compensated properly. All right, so let's go over a couple things. First things first, if you get hit and you feel like you're injured, the first thing you need to do is get evaluated by a doctor who's qualified in treating car accident victims. If you can't get to your primary or come in to see us, or say it's late at night or it's on a weekend, I want you to get over to the emergency room, get checked out, get it documented. Even if you feel like your injuries aren't substantial, a lot of times pain and injuries take time to set in. You got your adrenaline flowing, you're excited, inflammation hasn't quite set in yet, and things take a few days, but it's best that you get documented, get your injuries documented, and make sure everything's going to be okay. Now look, if you go to the emergency room and there's a time and place to go, and this is minus severe injuries, emergency rooms do a great job at letting you know if you broke something, if you're bleeding, and they make sure you're not going to die, and that's about it. And then they refer you out to whatever doctors, and that's their job. Their job is to take care of any immediate injuries and then get you over to the specialist. So many times you get in these accidents, especially rear-end accidents, and unless something's broken, bleeding, and you're not dying, they'll maybe take some imaging, maybe give some muscle relaxers, some anti-inflammatories, get you to feel a little better. They'll say you're okay, maybe you have a soft tissue injury, and they send you on your way. Not knowing that even a small car accident or a low-impact car accident can do quite a bit of damage to your neck and to your low back. And sometimes that pain or those symptoms or indications of that problem don't set in for a few days or even a few weeks. So don't always take what they say 100% to heart, because a lot of times there's injuries that maybe they miss. After you get to emergency room, the next best thing is to go see your primary, or come see us, or get to an urgent care doctor and get a further evaluation, maybe a little more detailed evaluation. If they didn't take any imaging, let's get some imaging, whether it's x-rays or MRIs or CAT scans, something to see what's going on, and get some appropriate medication to help slow down the severity or of the accident, or get the recovery process to start sooner. An appropriate medication will do that. Along with seeing a medical doctor, I think the next best thing is, in coordination with that doctor, is to come in and get some chiropractic care for a month, and typically it's 3 times a week for 4 weeks. And we want to do this for a couple of reasons. So number one, we want to do it to speed up the recovery process, to prevent further problems down the line. But also, if we're using an attorney and we have a case, we need to build your case. We have to document injuries. We have to show that you're out there physically trying to get yourself better. So protocol of care is 3 times a week for about a month, and then we reevaluate. And to see a medical doctor and get some medication during that time. So whether you go to the best teaching universities around or you go to the best specialists, all the same protocol is medication, therapy for a month, and then we see how you are. If you haven't progressed to where we want you to be after 3 times a week for 4 weeks and taken some appropriate medication, then we're going to order some imaging. And at this point, we probably should already had some x-rays to make sure that we're not dealing with any fractures or severe misalignments. Then the next thing we want to do at that 4-week mark is order MRIs. Okay, so say your neck is hurting you. We need to see if there's any soft tissue injuries that we're dealing with. So are we dealing with a herniated disc? Are we dealing with a pinched nerve? Are we dealing with muscle tears or strains? We want to know exactly what it is. 2 reasons. Number 1, so we can treat you more appropriately and try to speed up the recovery process. Number 2, we need to document your case. Your attorney's going to want to see that there's a physical problem that is being worked on, which will help your case. Again, I go back and forth. I'm talking to you like a doctor, and then someone else is kind of giving you advice of how to build your case. All right, so 4 weeks of care, medication. If we're still the same, then we're going to go imaging, such as an MRI of your neck or maybe a CAT scan. And at that point, we see what the problem is. If we do see some issues in there, then what we're going to do is refer you to a neurologist and an orthopedic. A couple reasons. Number 1, as building your case, we want to get as many other professionals in different fields all saying that you have an injury that was a direct result of your accident. So you'll have the emergency room, you'll have your primary or pain management doctor, you'll have your chiropractor who's doing the therapy on you. You're going to have a neurologist and you're going to have an orthopedic at that point. Okay, everyone's going to document what the problems are. So when your attorney goes to the insurance company, he has a full case and says, hey, we have multiple doctors all saying that they have the same injury. This is a documented injury. This isn't made up. They need to be compensated at that point. Along with a neurologist, they may order an EMG. So an EMG is electromyogram. And that test is where they're going to tell you exactly where the pain comes from. So you have multiple areas in your neck or in your low back, and we're not sure which one it is that's generating the most pain. They'll do these tests, 2 reasons. Number 1, to further document that we're dealing with a sustainable injury. And number 2, if they need to do injections like epidural steroid injections, they're going to be able to go to the correct spot to get you to heal faster, quickly. All right. So we've gone 4 weeks of care, we've taken some medication, we've got some imaging, we've gotten you to 2 or 3 more specialists. We're going to attempt to do another 4 weeks of therapy, along with more appropriate medication if they had to change it or not. And then during that 4 weeks, we'll, according to the pain management doctors or the neurologist, or really the orthopedic for that matter, there'll be a consideration for steroid epidural injections. So putting the medicine right on the bad spot, okay? A lot of people look into these things and think they're a bigger issue than they are. What it is, they're just gonna put the appropriate medication right on the appropriate spot to get you to feel better. And many times they try 2 to 3 times if they're not getting the results they want. Let me read my notes here for a second. Okay, so far you've been to the ER or your primary, you've been through a couple months of therapy, you've been to a neurologist, orthopedic, pain management doctor, we've considered injections. Another thing we'll consider is some home supplies. Do you have a TENS unit at home? Do you have ice packs at home? Do you have lumbosacral orthotics or pain relieving back supports at home? We want to see that you're doing things at home to actively recover from your injuries. If at that point, which 90% of our patients are feeling much better by that point. If we're still feeling there's issues and the doctors combined don't feel like what we're doing is getting you to respond the way that we want to, you may or may not be referred out for a surgical consultation. Okay, and that really depends on what we see on MRIs and what everyone sees as a combined effort. A couple things here. Number 1, remember, our goal is to get you better as quickly as possible and to get you back to your normal life. We want to get everything fixed up that's been injured in this accident. We want to make sure that there's a team of specialists that are looking at you so that no one misses anything. We get you to recover. Because what happens is we don't want this case to close, and 6 months later you start complaining of another injury that's probably directly resulted from the accident that never got resolved. So we want to make sure that everything's right. And all of this is being said because, again, insurance companies aren't always on your side. They do a lot of good for the world, but they will fight you tooth and nail sometimes when you want to get things paid for. But the closer we stick to a direct care plan, the easier things will be on you. So I hope some of that helps you out there. If you've been in an accident, God forbid, or a family or a member or friend has been in an accident and you're not quite sure what to do, just message me on Facebook or give me a call at the office. If you're down in South Carolina, you can look me up at Murrells Inlet Chiropractic.com. Again, that's Murrells Inlet Chiropractic.com. If you're watching this video up in Vineland at my South Jersey office, it's backpainrc.com, backpainrc.com. I hope this helps someone out there, and I hope everyone's having a great day. It's beautiful out there, and I will see you two guys. I'll see you guys tomorrow, 3 o'clock, for another edition of Dr. Ray TV. Have a great afternoon. Bye-bye.